Hi, my name is Dr. Simmer and we are going to discuss Norma frontalis. It refers to the frontal aspect of the cranium, that is, the anterior view of the skull. The bones forming the anterior view are the frontal bone that forms the forehead. Its upper part is smooth and convex, but the lower part, as you can see, is irregular and is interrupted by orbits and the anterior bony aperture of the nose. The right and left maxilla form the upper jaw. The right and left nasal bones form the bridge of the nose. The zygomatic bones form the bony prominence of the superolateral part of the cheeks, and the mandible forms the lower jaw. The norma frontalis is characterized by three large apertures, one anterior nasal aperture and two orbital openings. Each orbital opening is quadrangular in shape and is bounded by the frontal bone superiorly, the zygomatic bone laterally, the maxilla inferiorly, and processes of the maxilla and frontal bone medially. So the orbital openings have a supraorbital margin, a lateral orbital margin, infraorbital margin, and a medial orbital margin. The supraorbital margin is formed by the frontal bone. At the junction of its lateral 2/3 and its medial 1/3, it presents the supraorbital notch or foramen in some individuals. It transmits supraorbital vessels and nerves. The infraorbital margin is formed laterally by the zygomatic bone and medially by the maxilla. The maxillozygomatic suture is present inferior to it. The medial orbital margin is formed by the frontal bone above and the lacrimal crest of the frontal bone process of maxilla below. The lateral orbital margin is formed by the frontal process of the zygomatic bone below and the zygomatic process of the frontal bone above. Here you can see that clearly. This is the frontal zygomatic suture between the frontal and zygomatic bones. The piriform or anterior nasal aperture is the pear-shaped bony inlet of the nose formed by nasal and maxillary bones. It is narrower above and wider below. The internasal suture is present between the right and left nasal bone. The lower end of this suture is known as the rhinion, and the upper end that unites with the frontal bone is known as nasion. Below the aperture is the intermaxillary suture. The superciliary arches are rounded curved elevations situated above the orbit and connected by a median elevation known as glabella. The nasion is a median point at the root of the nose where the internasal suture meets with the frontonasal suture. The maxilla is the upper fixed bone of the jaw formed from the fusion of two maxillary bones. The two maxillary bones are fused at the intermaxillary suture, forming the anterior nasal spine. The infraorbital foramen is present 1 centimeter below the infraorbital margin, right here. It transmits the infraorbital vessels and nerves. The lower alveolar border of the maxilla has the alveolar sockets and teeth. The roots of the incisor teeth have this incisive fossa. The zygomaticofacial foramen is present in the boundary of the zygomatic bone. It transmits the zygomatic-facial nerve. The mandible. It forms the lower jaw. In the midline, this is the symphysis menti. And a lower prominent area, the mental protuberance. Laterally, there are mental foramen that transmit mental nerves and vessels. Now, to summarize the vessels and nerves passing through different notches and foramina, the supraorbital nerve, which is a branch of the ophthalmic division of trigeminal nerve, is transmitted through the supraorbital notch of foramen. The infraorbital foramen, it transmits the infraorbital nerves that are branches of the maxillary division of trigeminal nerve, and the mental foramen transmits mental nerve that is branch of mandibular division of trigeminal nerve.